Hi everyone, I'm Andrea with DZ Logic and I'm here with Dr. Sergey Dzugan, one of the world's leading experts in physiology. Dr. Dzugan, thank you for taking the time today to speak with us. We know it's a difficult time, lots of uncertainties, and we wanted to answer some questions we have received from our members. So let's just get right started. Dr. Dzugan, in your opinion, what's the best way for us to protect ourselves and our families from the COVID-19 virus?
Thank you, Andrea, for your question and invitation to talk today and discuss this very excited, I will say, topic.
It sure is.
First of all, I would like to say that what we need to do first, do not panic. We do not need to panic because 60–70% of problem that we have is panic that was created by media. Second, of course, we need to be healthy, and if we have any health issues, we need to protect our body from any dangerous agent that can destroy our body even more. And we recommend it for all our patients, keep immune system in good condition. So if your immune system will be strong, the risk that you will get this dangerous coronavirus is not very high. Okay. This is the same thing like for many years I work in private cancer clinic, and what we did for all our cancer patients, we always improve immune system, and better immune system, better quality of life, less risk of getting any kind of problem.
Okay, so what is the best way to boost our immune system? What can we do?
First, as you know, approximately 60–70% of patients who have this problem, they are patients after age 60. And why it's happened? Because around this age, again, our immune system starts to decline tremendously. And the best healthy group is between 20 and 30. Mm-hmm. So this group usually get any kind of diseases, infectious diseases or malignancies, less than any other groups. And at this time, our body foundation, our body physiology, our body biochemistry works at the best way. And this is what we try to do. We always try to improve body physiology or body foundation to the point like most our clients had between age 20 and 30. So in young age.
Okay. So for me being on the program, for example, I'm already doing everything I can, or should I take more supplements right now to extra boost my immunity, or is my program going to help me stay healthy?
During any critical situation, it is better to use some extra because this is what happened quite often with our current clients when they travel or when they ask for any help during flu season. They ask, can we suggest some supplement that can improve immune system and can decrease risk of getting new cancer? Right. So stronger your body, better results. That's why it is always better to use some specific supplement that normally we use for clients who have a pretty serious problem with immune system, like patients who had cancer, or patients who had Lyme disease, or patients who had any kind of autoimmune diseases, include diabetes type 1, or scleroderma or rheumatoid arthritis. So we use some specific supplement that can help to our patients when we have any kind of critical events like this coronavirus.
Could you point some out for us?
Yes. For example, I will say this way: probably 100% of our current clients use programs that restore body foundation. They use different kind of vitamin supplements, different hormones, not prescriptions such as pregnenolone, DHEA, and some prescription hormones like estrogen, progesterone. But we always recommended some stronger supplements like thymic protein that can increase number of white blood cells that fight specifically with different type of germs and viruses.
Okay.
And make our immune system stronger, or 3-beta-glucan that increase number of macrophages. Macrophages is big cell that eat different debris or damaged cells or dead cells, or again any kind of invaders like germs and viruses. And always we use for patients in such period of time when they need to fight with any kind of serious condition, we use, of course, different kind of probiotics that restore natural intestinal flora. Because what happened, unfortunately, in our country, very many patients use several drugs for different conditions, and in majority of cases, all these drugs, not all of them, but most drugs destroy natural intestinal flora. So some agents that normally live in your body and didn't create problems, during weak immune system, they can be active and they can create any new problems. That's why what we do, we use our regular program, plus we use specific supplements like I mentioned, thymic protein or beta-glucan, and we always restore natural intestinal flora. So absorption of supplements will be better. Absorption of food will be better. So toxins will be removed quicker, and any kind of normal flora that lives in your intestinum and your stomach, they will not be activated, and they will not take power, so they will not create real problem for your body.
Wonderful. So even if I'm not at the risk group over 60, does this apply to me as well? So should it only be people over 60, or can everybody just?
No, it should be applied for everybody.
Right.
Even kids who have a pretty good immune system, but quite often it can be compromised because, as you know, many kids use different also drugs like for attention deficit hyperactivity disorders or for autism, or children go through puberty and hormonal levels change tremendously, and children have like hurricane in their body with all these hormonal changes. And hormones control different aspects of immunity, and quite often we need different agents that can make immune system stronger and not blind. Because quite often you can have, like with autoimmune diseases, you can have strong immune system, but it will be blind. It's like someone put some shutters on the windows, and you cannot see clear in your house. And this is what happened. That's why it is better to use some preventative supplements and vitamins for different aging groups. And again, please remember that there is no guarantee that something can prevent for 100% and you will not be sick. But definitely, if your immune system will be stronger, if you will feel better, if you will not be depressed, if you will sleep normally, if your sexual life will be good, if you will not have any kind of anxiety or depression or whatever, the risk that you will get this problem is much, much less. Because as soon as you feel strong and you're doing normal exercise during daytime, so you do not need excessive exercise, but normal exercise, your body will strong and will tolerate any kind of problems.
Wonderful. Oh, thank you so much for your insight, Dr. Dzugan. I really appreciate your time.
My pleasure. Thank you.